Hi, I'm Ted Kruse with Physical Therapy Solutions out of the Dyersville office, and today we're going to talk about carpal tunnel syndrome. Carpal tunnel syndrome is a common issue that we do see in outpatient physical therapy. We'll see patients preoperatively with the hope of controlling their symptoms, minimizing their symptoms, or getting those symptoms to go away completely with conservative means, stretching, exercises, and some adjustments in your daily activities. The carpal tunnel syndrome is impingement of a nerve. The most common symptom that we hear a patient describe would be numbness and tingling. Most typically in your hand, it would be across the outer portion of your hand, your thumb and your next two fingers. That's the distribution for the median nerve in your hand. If we take a look at the anatomy, the carpal tunnel goes through the anterior aspect of your wrist, and we can open that up and see, and that's exactly what the carpal tunnel is right there. The tunnel is going to be the home of tendons that go down through the wrist into your fingers to supply wrist and finger function, but specifically what we're looking at is the nerve here. This is your median nerve, and if that area of the carpal tunnel becomes bound up with scar tissue or other soft tissue structures, there's not enough space for all of those tissues to function, and the odd man out, you could say, is that median nerve. If that starts to become impinged, just like any nerve in our body that gets pressure, we start to have neural symptoms such as numbness, tingling, weakness. Sometimes those symptoms start off as just activity dependent, but they can become more and more severe and become persistent where they're present all the time, and that's when we typically start to see people. What we do conservatively in physical therapy is we'll educate them on what it is, and I think that's important so that you understand what symptoms you're having and why, and that can also lead to how you can modify some of your daily activities at home or possibly at work to help alleviate those symptoms. Whenever we have a nerve that's getting pinched, we want to take away that pressure as much as we can so we don't start having long-term effects or nerve damage. Some stretches that that are very common for carpal tunnel syndrome primarily is called a wrist extension stretch, where we'll come out in this position, grab and pull down to try to open up that carpal tunnel. We want to stretch that out, stretch all those tissues out so that there's less pressure at the end. After those tissues are stretched out, there's less pressure on that median nerve, and then hopefully we see their symptoms of numbness, tingling, weakness start to subside. Some other treatment options that are very common that we do in physical therapy would be using A-stim. That's augmented soft tissue mobilization, utilizing some tools to kind of work through the palm, through the carpal tunnel, and through the wrist musculature, forearm musculature, to try to loosen up those structures, open them up, and take pressure ultimately off that median nerve. There are modalities that we can use as well. We have a lot of things at our disposal to try to help for these symptoms. If that is not working, we can become a little bit more aggressive. Sometimes a night splint is used. Night splint is simply a wrist splint that will keep your wrist in this kind of neutral position while you sleep at night. It's not uncommon to have night symptoms, so that splint will keep you here and keep too much pressure from that carpal tunnel, hopefully giving that median nerve some relief. If none of these things are working, then moving forward, talking to a hand specialist, possibly an injection will help, and down the road, if nothing is helping, then surgery is indicated. If you have questions on carpal tunnel symptoms, if this is something you might be dealing with or want to talk to us more about it, feel free to contact us at our Dyersville and Manchester location. You can check us out on our website, www.ptsiowa.com, or check us out on Facebook. Thanks a lot.